how did I first ever become interested in becoming a doctor, or what was the development of that decision in my life? Probably the first thing that happened to me, Ed, was that when I was in third or fourth grade, I lived out on the high plains, eastern high plains of Colorado, high desert plains, and it snowed there once, and it never snows there, and it snowed once. I lived there for 2 years, and when it snowed, I took a broom and went and swept off our driveway, our sidewalk, and then I went and did the neighbors, and then I went and did their neighbors, and then I wound up going. I didn't want to cross the street because that was something that I had to ask permission for, but I went around the entire block and I swept off everybody's sidewalk and the public sidewalk, and then when there was like 4 times as I went around, and I remember the one man came out. He's a big dude, and he said, "Young man, what are you doing?" And I thought I might be in trouble, and I said, "Well, it snowed, and I don't want people to slip and fall, so I'm sweeping off everybody's sidewalk." And he said, "When you're finished, come and see me." And so I did. And so what year would that have been? I was probably 7 years old. So about 1963 or 60. Yes, I think it was 63. And at any rate, after I swept his sidewalk and driveway, I went up to the door, and the man came to me and he said, "I want to thank you so much. That is so wonderful of you." And he gave me $1. $1. In 1963, $1 was a huge thing for a third grade kid. And I started thinking, this is my nature anyway. My mom was the same way. She was just such a kind and loving woman. And tomorrow would be her 102nd birthday, had she not died at age 97. So at any rate, that got me thinking maybe I could monetize this penchant that I have for doing service for people, and that kind of got me thinking. Of course, I didn't have those kinds of aspirations at that time, but as time went by, I decided in high school, I guess it was probably sophomore year of high school, that I wanted to go into medicine. And I started a club called Future Doctors Club. And there was about 5 of us, and 2 of us actually are physicians now. So I knew for a long time that I wanted to do something in service. And after that, I went to I graduated high school, went to, did a bachelor's degree, did a master's degree, went to medical school, did residency and all that. So my educational history was that I went to 3rd grade in a small town called Graytown, Ohio, east of Toledo. And then we moved to Colorado on the high plain desert out east, near La Junta, Colorado. And it was a town called Fowler. And that was for 2 years. Came to O'Fallon, Missouri in 5th grade, went through that public school system, and the high school was called Fort Zumwalt High School. I then went to Central Methodist College in Fayette, Missouri, got a bachelor's degree there, did a master's degree at University of Missouri, Columbia, and then got into med school, at St. Louis University, went there for 4 years and did my residency at St. John's Mercy Hospital in St. Louis County. And then I've been in, I did a number of jobs, did some years of critical care, which is running intensive care units, and went into private practice in 1988. Ed just asked me what my thoughts are about the medical system in this country and how the differences from when I was young, and particularly when I was young in the practice of medicine, versus how the healthcare system is now. And the way I met Ed was I started doing house calls on his mother, who was homebound, probably about 15 years ago. And of course, hardly anybody does that nowadays. Back in the old days, when I was a kid, you know, doctors came to the house routinely. And though I never had a doctor come to the house because we were poor and didn't get much medical care. And thank God we were all very healthy, raised on a farm for, you know, my early childhood. And nowadays, seeing doctors who do house calls is very rare. I still do a few, and I used to have 3 nurse practitioners working for me, and we would do about 80 house calls a week, because there was just nobody out there for homebound people at all. And so I had met people in the home health care industry, and a dear friend of mine owns her own home health care company, and she helped me figure out how to actually make money at doing house calls, because when I did house calls previously, billing it was terrible, and basically I didn't get paid for my time, and I can only afford to do so much of that. But when this woman helped me to, and my staff to figure out how to do it and actually get paid properly, then I went full into not 100% of my practice, but probably at that time, it was as much as 50% of my practice for a long, long time. Total of almost 20 years now, but a couple years ago, I could no longer get nurse practitioners to do it because the major health companies, the big, huge conglomerate medical companies, they suck up all the nurse practitioners. They can afford to give them 401ks and everything under the sun, and all I could offer them was health care insurance. And so that aspect of my practice has fallen off greatly. I do have one nurse practitioner now, and we're trying to get that going some more. What I was also going to speak to is how when these huge conglomerate corporations, now that they are running the healthcare system, there's little or no room for primary care, private doctors that are not associated with these huge corporations, and so being one's own boss in medicine now is a rare thing. And I don't know, other than me, I don't know of even a half a dozen of other doctors who are independent anymore.
Wow.
And of course, back when I was young, in the business, doctors still ran the business of medicine. Mm-hmm. And now, businessmen run the business of medicine. Mm-hmm. And so the choices that are made for people in the system, patients, aren't being made by businessmen and insurance companies instead of being made by doctors and nurses and people who are trained in medicine, people who are trained in business and profit margin and that sort of thing are running the show. And it's a sad state of affairs, but that's the way it is.
That's the way it is. I agree.
So I was talking about not being able to get nurse practitioners because the big business medical companies really just can offer them so much more than I can as a private solo doctor. And what Ed and I have also discussed was that when I was new in medicine, and I graduated medical school in 1982, pretty much doctors and nurses were running the medical system. And insurance companies were companies that just received bills and paid them. And so over the years, huge medical conglomerates and insurance companies have pretty much taken over a lot of how medicine is practiced. And so instead of these decisions taking place by doctors and nurses and all, so much of what is done nowadays is determined by somebody at an insurance company. And a lot of times it doesn't make much difference whether you use this product or that product. They're all pretty much the same. But a lot of times it does make a big difference when insurance companies will deny the request for an MRI or a CT scan or other things, that's pretty essential to a patient's care, and the doctor just doesn't get any choice in the matter. So it's a lot different now, and especially being in private practice, it's made a lot tougher by all of that, and that's about the shape of things. It's a shame that doctors and nurses don't have more input to these systems, the insurance companies and the gigantic medical companies. But that's just the way our country has moved, and that's the only thing we can do is just work with the system. How does somebody in my position feel about the changes in medicine, and what is my response to it? And I'm not very happy with the way our medical system has changed directions, but it is what it is, and all I can do is be faithful to my patients and try not to be faithful to the people that run the show, who are more concerned about money than they are about my patient's care. And that is what I've done, is I've just remained faithful to my patient's needs, and it has gotten me in trouble a number of times now. Dedication to my patients versus paying attention to what the state or insurance companies or big business medicine wants. There's been some troubles with it, but I just keep doing what I do.